My name is Alexandra Rapp, and I'm a sophomore at the University of Minnesota Twin Cities studying health and well-being sciences. I'm super excited to share my research on how antidepressants impact vaginal bacteria. This study investigates potential interactions between antidepressant treatments and the vaginal microbiome, which could have significant implications for women's health. To start, the vaginal microbiome is predominantly composed of lactobacillus species, which maintain an acidic pH and protect against pathogenic infections. When this balance is disrupted, it can lead to bacterial vaginosis, or BV. BV is a condition associated with serious reproductive health risks, including preterm birth and increased susceptibility to STIs. Depression, which disproportionately affects women, is often treated with antidepressants. While these antidepressants are effective, these drugs can cause side effects like vaginal dryness and sexual dysfunctioning, potentially influencing the microbiome. Despite all of this, the direct effects of antidepressants on vaginal bacteria remain largely unexplored, which is the focus of this research. Our main objective was to investigate how 5 common antidepressants, sertraline, fluoxetine, citalopram, duloxetine, and mirtazapine, affect 6 key vaginal bacteria species. These included beneficial lactobacillus species and pathogens associated with BV, such as G. vaginalis and P. vivia. We hypothesized 2 things. Antidepressants would inhibit lactobacillus species more than anaerobic bacteria, and that gram-negative bacteria, like G. vaginalis, would be more susceptible than gram-positive bacteria due to differences in their cell wall structure. To assess the impact of antidepressants on vaginal bacteria, we conducted minimum inhibitory concentrations, or MICs, using 6 key vaginal bacteria species. Each bacterial species was cultured under anaerobic or aerobic conditions as appropriate and normalized to a McFarland 0.5 standard. Bacteria were exposed to varying concentrations of sertraline, fluoxetine, citalopram, mirtazapine, duloxetine, and clindamycin in a 96 well plate format. Growth is monitored via optical density readings and visual inspections, with positive controls, clindamycin, confirming effective bacteria inhibition, and negative controls ensuring solvents did not impact the growth. Our data revealed some very interesting trends. We saw that gram-negative bacteria, particularly G. vaginalis and P. vivia, were more sensitive to antidepressants compared to lactobacillus species. Among all the antidepressants, sertraline, fluoxetine, and duloxetine had broad-spectrum inhibitory effects, inhibiting both beneficial and pathogenic bacteria at low concentrations. G. vaginalis was inhibited most consistently throughout all the bacteria, suggesting a potential therapeutic implications for managing BV. Citalopram demonstrated the least inhibitory activity across both beneficial and pathogenic bacteria, positioning it as a potential microbiome-preserving antidepressant. These findings suggest that gram-positive bacteria, like lactobacillus, are less affected by antidepressants, possibly due to their thicker cell walls, which provide structural protection. These findings highlight a dual role for antidepressants in moderating the vaginal microbiome. While their inhibitory effects on pathogens like G. vaginalis could present therapeutic benefits for conditions like BV, the potential risk of disrupting beneficial lactobacillus species raises important questions about unintended side effects. Antidepressants like sertraline and fluoxetine may offer secondary benefits by inhibiting BV-associated pathogens, warranting further exploration into their role in managing BV. Drugs like citalopram may demonstrate minimum inhibitory, may be preferable in cases where maintaining microbiome integrity is crucial. This insight could guide clinical decisions in prescribing antidepressants, particularly for women at risk of BV or other microbiome-related conditions. This research underscores the interconnectedness of mental and physical health, particularly the role of the microbiome in influencing systematic conditions like depression. Understanding these interactions opens the door to novel strategies that optimize both mental health outcomes and microbiome stability. To build on these findings, future research should focus on in vivo studies to confirm these in vitro observations, examining how antidepressants interact with the vaginal microbiome in real-world settings. Ultimately, the research highlights the need for a personalized medical approach where antidepressant selection considers an individual's microbiome profile, ensuring optimal efficiency and minimum unintended consequences. In conclusion, this research underscores the complex interactions between antidepressants and the vaginal microbiome, offering insights that could guide more personalized and effective treatments for depression. Thank you for listening.